So my name is Phyllis Nelson, and I am a nurse practitioner. I have a family nurse practitioner degree, and I also have a psychiatric nurse practitioner degree. And it's always good to have both because, your brain is, mental health is part of your health. And so you want to take care of your whole body, mind, body, spirit. So mind for mental, body for different diseases, and then spirit for your spiritual or religious beliefs. So this presentation is on raising awareness on mental illness and what habits that can affect our well-being. So what is mental health? Well, mental health includes our emotional, psychological, and social well-being. It affects how we feel, how we think, and our behavior as we cope with life and different situations. It determines how we handle everyday stress and how we relate to and communicate with others. So, mental health is really important because it's how we make choices in our daily life. Mental health affects every stage of life, including childhood, adolescence, adulthood, and when you become a senior citizen. So taking care of your mental health can reduce your risk of developing mental illness. So how do we do that? So I'm going to talk about how to take care of your mental health. So millions of people are affected by mental illness each year, and one of them could be you or someone that you know. Raising public awareness helps to eliminate that stigma that people have about mental illness, and that can cause people not to seek treatment because they don't want anybody to think of them as weak or something, because that's part of the stigma of having a mental illness. But we're going to learn that that's not true. Let's see. So according to NAMI, which is the National Alliance on Mental Illness, 1 in 5 adults experience a mental illness each year. So this room has 1, 2, 3, 4 people. If there was one more person in the room, and that doesn't mean somebody has a mental illness, but 1 in 5 people are at risk for mental illness each year. And then 1 in 20 adults experience a serious mental illness, which is probably somebody who is suicidal or maybe who has schizophrenia or something like that. Now, when we look at children, 1 in 6 children ages 6 to 17 experience a mental health disorder each year. So those disorders could be autism, it could be ADHD, it could be oppositional defiant disorder, which is kind of like when you have a kid who is always getting into trouble, or no matter what you tell them, they're always combative and doing the opposite of what you ask them to do. Those are some of the things that can happen with children, or even depression and anxiety. 50% of all chronic lifetime mental illnesses begin by age 14, and then 75% by age 24. So when we look at those ages, 14 is usually the age when people start high school, right? And then 24 is the age that people graduate from college and when they're trying to become an adult. So those are highly stressful times in a person's life, and that's when they can develop things like depression and anxiety are the most mental illnesses that they do develop. Suicide is the second leading cause of death among people 10 to 14. So 10 to 14, when you think about it, that's middle school. And so what happens in middle school? What starts happening in middle school? Bullying. So that's one of the reasons that a lot of kids between 10 and 14 try to commit suicide, because they're being bullied. And suicide is preceded only by unintentional injuries in this age group, which can include motor vehicle accidents, falls, sports injuries, drownings, poisoning, fire, burns, and suffocation. So that's, that's pretty sad that that is the second leading cause of death for that age group, 10 to 14. So we really need to get serious about this bullying thing. And we really need to get serious about social media and limiting it, especially in the classroom. So trying to tell the difference between what's typical behaviors for children and the signs of mental illness is not always easy. Symptoms of mental illness may be the result of a physical illness. So even in adults, it's hard to tell. So sometimes people might have a vitamin deficiency. So if you have a vitamin D deficiency, you're going to have symptoms of depression. If you had a hypothyroidism, you can have symptoms of depression, fatigue, low energy, low mood. So it's important that you always have a yearly physical first. And then if they rule out anything physical, then that's when your primary doctor needs to refer you to a mental health specialist. Common signs of mental illness in adults and children or adolescents can include excessive worry or fear, feeling excessively sad or low, extreme mood swings. So very low mood or uncontrollable high mood. Prolonged or strong feelings of irritability, anger, avoiding friends, social activities, and then difficulty understanding and relating to others. Sometimes they have changes in sleep, so they'll have trouble falling asleep, which is more associated with anxiety, or trouble staying asleep, which is associated with depression. Or they can sleep for an extended period of time, which is also more related to depression. Feeling tired and low energy, changes in eating habits, so you can have an increased or decreased appetite, so you're going to be losing or gaining weight, unexplained, changes in your sex drive, which can be increased or decreased, difficulty perceiving reality, so a person might get paranoid, or they might even experience hallucinations, and they can see, hear, smell, or feel things that aren't really there. So that's a hallucination, and a delusion is a thought, like a paranoid, like somebody's trying to come after you. Inability to perceive one's feelings, so you just basically lose your lack of insight, and you don't feel, you're not aware of your own feelings, your behavior, or your personality. So that person can look like muted or dull and just kind of like zoned out. Overuse of substances like alcohol or drugs, multiple physical ailments. My son, he has anxiety, depression, and they say he's bipolar. I'm not sure if that's a correct diagnosis, but because he doesn't take any medication and he supplements and exercises, does lifestyle stuff. But he has, his depression always exhibits as headaches, stomach aches, something physical. And so he always go to the doctor and they can't figure out what's wrong. And then it usually goes away. And it always happens in the winter when there's this, less sunlight. So yeah, that's one of his symptoms. Thinking about suicide, inability to carry out daily activities. So you're not bathing, you're not combing your hair, you're not able to do your bills or go to work. An intense fear of gaining weight, or an intense concern of your appearance. So those are some of the signs, warning signs that you want to be aware of. Anything that's different than your usual behavior. So mental illness in children, it can begin to develop in young children, which it usually does. But because they're still learning how to identify and talk about thoughts and emotions, their most obvious symptoms are going to be behavioral. So that means changes in school performance. They might have been an A student, but they might start getting C's and D's. Excessive worry or anxiety, or, they might start fighting and trying to avoid going to bed or to school. So if you have a grandkid or a kid that's all of a sudden they don't want to go to school, they're fighting with you, or they don't want to go to bed. And so you need to investigate that. They're probably being bullied by somebody at school. Hyperactive behavior, so that can be associated with ADHD or bipolar disorder. Frequent nightmares, and the key is frequent disobedience or aggression, and then frequent temper tantrums. Because all these are normal, but if they're frequent and they become excessive, then that's when you need to be concerned. And so mental disorders are real and disabling. They have a huge impact on the individual with the mental illness and with their families. And they can vary in type and severity. So the mental illnesses that I'll be talking about today I'm going to focus on major depressive disorder, generalized anxiety disorder, and bipolar disorder. So depression is the first symptoms that we'll be talking about, and it's the leading cause of disability in the United States for people 15 to 44 years of age. So there's a lot of people, that have depression. Depression episodes include symptoms that are severe enough to cause noticeable difficulty in a person's day-to-day, activities like work, school, and then social activities and their relationships. So if it's interfering with those, and that's the key, it has to interfere with your day-to-day activities. A person experiencing a major depressive episode must experience 5 or more of the following symptoms. And at least one of them has to be a marked loss of interest or feeling no pleasure in all or almost all activities. So that's the first one of 2. Or they have to experience a depressed mood, such as feeling sad, empty, hopeless, or tearful. In children and teens, a depressed mood can appear as irritability. And irritability is defined as the tendency to be angry and reactive to slight provocations and disagreements. So if you have a really irritable, difficult child, all of a sudden and this is subjective because, teenagers tend to be that way anyway. But if it's really extreme, and you have to know what's normal for your kid, but if it's really extreme and like anything you say to this person, they're gonna like jump at you and, be combative with you, and it's constant, then you need to, maybe investigate it and have them assessed to make sure that it's not just, average teenage stuff. The remaining 4 symptoms, so remember we said they must have 5, and at least one of them has to be the first 2 that I mentioned. But then the remaining 4 symptoms can include significant weight loss, not dieting, weight gain, or a decrease or increase in appetite. But in children, a failure to gain weight is a sign of depression. Insomnia or sleeping too much. So insomnia is not being able to fall asleep, or sleeping too much, like more than 10 hours. You're sleeping and the person's been in the bed since 8 o'clock at night, and it's 10 o'clock in the morning, they're still sleeping. So that's a problem. Restlessness or slow behavior. So if a person is agitated or jumpy or wiggly and can't sit still, or they're just completely out of energy and they're just really fatigued, that's a sign. And then feelings of worthlessness or excessive or inappropriate guilt. Some people who have depression feel really guilty about something, and and there's no reason for them to feel guilty, but they feel guilty. And so that's a really good common symptom. Some people have difficulty concentrating or being indecisive. They just can't make up their mind. So you really have to do a really good history to make sure that it's not depression, or is it ADHD, is it, what it is, because a lot of these symptoms kind of slide together. And then thinking about planning or attempting suicide. If somebody tells you that they want to hurt themselves or harm themselves, or they tell you, I'm going to do this, I'm going to do that, believe it. Don't think that you're just trying to get attention, because, yeah, they are trying to get attention because they're calling out for help. That's what they're doing. So you need to get help for them. You need to give them the attention and get them the help that they need. So symptoms of anxiety. So occasional anxiety is a normal part of life. However, people with an anxiety disorder have intense, excessive, persistent worry and fear. So anxiety interferes with the person's daily activities. It's difficult to control. It's out of proportion than the actual danger, and it lasts for long periods of time. So people may avoid places or situations to prevent these feelings. Symptoms often start during childhood. So if you know a kid who always has anxiety, a lot of kids have separation anxiety. That's normal. But once they get past a certain, once you kind of ease them into the situation and they get used to the situation, then they usually, don't have the separation anxiety anymore. But if they continue to have this and they're like 10 years old or they're in middle school, then that's a problem. Symptoms often start during childhood or the teen years and continue into adulthood. Some of the common signs and symptoms are feeling nervous, restless, or tense, having tense muscles. Like they might complain of shoulder pain or neck pain or headaches. A sense of impending danger, panic, or doom. Like they just feel like the end of the world is coming. They can have a increased heart rate. They can hyperventilate, sweating, trembling, feeling weak and tired, trouble concentrating, trouble sleeping, or they might just have some GI problems and complain of a stomach ache all the time. So that was the one that my son used to complain of when he was actually in the 3rd grade. So he actually had depressive symptoms in the 3rd grade that I didn't realize. So remember I said it usually starts in childhood, and now he's become an adult and he has, this diagnosis. Difficulty controlling worry, avoiding things that trigger anxiety. So it's important to see your doctor if you feel like you're worrying too much and it's interfering with your life, work, relationships. If your fear, worry, and anxiety is upsetting you, then you need to see a doctor. If you feel depressed and have trouble with drugs or alcohol or other mental health concerns, you need to see a doctor, because a lot of people self-medicate with alcohol and drugs. So usually people just don't use alcohol and drugs, all the time. It's usually because they're self-medicating some type of stress or anxiety or depression that they have. If you think your anxiety is linked to a physical health problem, like I said, always see your primary care doctor first, and they can rule out like a vitamin deficiency. And then if you have suicidal thoughts or behaviors, always talk to your doctor. You really should call 911 and tell somebody that you trust. So now let's talk about bipolar disorder symptoms. So that's the last thing we're going to talk about as far as mental illness diagnosis goes. But bipolar used to be called manic depression. Anybody familiar with that description, manic depression? And it's a mental health condition that causes extreme mood swings. So they can swing from really high, mood, like when a person is like really euphoric, to really low mood. And when depressed, they feel sad and hopeless and lose interest or pleasure in most activities. And these symptoms must be present for 7 days or more. And when your mood shifts to mania or hypomania, which is the more euphoric mood, you may feel euphoric, full of energy, usually unusually irritable. And these mood swings affect your sleep, your energy, activity, judgment, behavior, and your ability to think clearly. So you can get really confused in a manic or a hypomanic state. Mania symptoms cause marked impairment and must be present for 7 or more days. So it can really cause problems in your work, in your relationships, social life. Hypomania symptoms don't cause marked impairment and are present, have to be present for 4 days, but less than 7 days. And usually people who have hypomania, they're like really high functioning and they can get a lot of stuff done. And, a lot of people are like, wow, this person is great. They're a type A personality. They can get the work done. But it can be a problem. That's not always a good thing. Episodes may occur rarely or multiple times a year, and most people experience symptoms between episodes. But some may not experience any symptoms. Bipolar disorder, so when a person has anxiety and depression, they can have a one-time episode, and then that's one and done. Or they can have chronic, depression and anxiety. A person who has bipolar disorder, that's a lifelong condition, but it can be managed with treatment, which includes medication and psychological counseling. So it's important to know, if a person truly does have bipolar disorder, then they need to continue to take the medication, and they need to continue their counseling with their therapist. And so that's why I say I'm questionable whether my son's diagnosis is correct, because he doesn't do any of those. And when you have bipolar, you really do need to take the medication. So we talked a little about the 3 different types of episodes that can occur with bipolar disorder. And depending on what symptoms you have, that's what determines if you're diagnosed with bipolar 1 or bipolar 2. So there's 2 different types. So when we also mentioned how mania and hypomania episodes have the same symptoms. And however, mania episodes only occur in bipolar 1. And they are more severe than hypomania. And they cause more noticeable problems with work, school, social activities, and relationships. And also, mania may also trigger a break from reality and require hospitalization. So that's like a psychotic episode when a person starts having hallucinations or delusions. That's what that means when you have a break. Now, one thing I can say about bipolar 1 disorder is if you are using psychedelics, or crack or something like that, a person could have a manic episode or have mania because they're using drugs. So it could be drug induced. But once they become clean, then they no longer have those manic episodes again. So that's another way you can have manic episodes, or bipolar that's caused by a substance. A person diagnosed with bipolar 2 has to have experienced 1 major depressive episode, and then broken up by periods of hypomania. So bipolar 1, you have the mania at least one time, and you don't have to necessarily experience a depressive episode. You can just have the mania, but you can have depression too, but it tends to be milder. And then a person with bipolar 2 has the hypomania, but their major symptom is depression. A person who experiences hypomania and mania must experience 3 or more of these symptoms. So I'm going to list a couple of them. Abnormal, upbeat, jumpy, or wired. So think about some celebrities that you know who kind of seem kind of, or even public figures who seem kind of wired and jumpy, or increased activity, energy, or agitation, exaggerated sense of self or well-being. So they're really self-confident, more than they should be. Decreased need for sleep, unusual talkativeness, racing thoughts where they can't shut their mind off, they can't shut their thoughts off. And they're trying to go to sleep, but they can't because their mind is racing. Distractibility, poor decision-making, they go on these buying sprees, they take sexual risks or foolish investments. And then people who have pressure speech, they're the kind of people where you can't even have a conversation with them because they're talking so fast. They're that kind of talking. And you're just you're looking at them what in the world? Because they won't stop talking and you can't even get a word in edgewise. So that's what that is, talkative speech or pressured speech. So children and teens can actually be diagnosed with bipolar disorder, but it's real difficult to diagnose them because they have these mood swings. They have ups and downs, and the result of stress or trauma, that could be why they're having these really extreme mood swings, because they might have been traumatized, or they might have had been bullied or something. And so the signs of mental health problems could be something else. Those signs could be some other health problem, mental health problem, instead of bipolar disorder. Children and teens may have depressive, manic, or hypomanic episodes, but the pattern can vary from adults with bipolar disorder. So if a kid has these symptoms, usually an adult, they're going to have the symptoms, and they might have one a year, maybe 2, 3 if they're lucky. But when you look at kids, they call them rapid cycles. So they'll go through this fluctuation in their mood in a day, and you don't know what's going on with this kid. And I've seen it before, a kid that's rapidly cycling, going from depression to mania, to depression to mania. And so it can happen all day for a day, or for a week, and they're just all over the place, and they're exhausted. The most prominent signs of bipolar disorder in children and teens include severe mood swings that are different than their usual mood swings. So that's going to be hard to tell. So you got to really know this kid in order to be able to tell if are these mood swings different? Are they worse? Despite extreme mood swings, people with bipolar often do not recognize that they're having all this emotional instability. They're driving everybody else nuts, but they don't think they have a problem. So it's really hard to treat these people unless they start getting into financial difficulty or difficulty with their relationships, or losing their jobs, because a lot of them lose their jobs and they jump from job to job to job. And in fact, some people with bipolar disorder, they actually enjoy the euphoric part of the mania, because they get all this energy and they feel high, and they're just like, they think they're, God or Jesus or, some other person, and, they have these delusions of grandeur. And I'm going to mention one person like that. That's Kanye West, because he's always in the news, but he is definitely bipolar, because he's always, how when he gets bipolar and he does those really crazy, he gets on TV and just talks really crazy, and you just want to, you're looking at him, you say, where is his family at? Why aren't they getting, because you feel bad, but he can't help it. But somebody needs to reel him in, and put their foot down. So unfortunately, he has that money, so nobody's going to do that to him. So he's just going to continue to suffer. And then, if you have any symptoms of depression or mania, you want to see your doctor or your mental health provider. And bipolar disorder doesn't get better on its own. So you do need to make sure that you get treatment. So that's really important to know. Now we're going to talk about some mental health disorders that are caused by for a brain injury. So if a person is in an auto accident or something like that, or sometimes if they have a stroke, or if they have brain tumor, cancer, or something that could damage the brain. So mental disorders occur in every racial, ethnic, and social economic group. And although the specific causes of most mental disorders are not known, many risks have been identified, including biological, caused by brain trauma, psychological, related to stressful events, and then socio-cultural factors, including poverty, trauma, and so family history of mental and addictive disorders can also increase your risk. So when we look at brain injuries, so in cases of mild head injury, 1 in 5 people experience mental health problems afterwards. Traumatic brain injury can lead to mental health issues because your brain is responsible for your behavior, your thinking, and your feelings. And once injured, the brain may not return to the same level of function before the injury. And because our brains affect our thoughts, feelings, and behaviors, Brain injuries can lead to post-traumatic stress disorder, depression, anxiety, mood swings, aggression, and insomnia. So if you know somebody who has a brain injury related to, it could be a stroke, it could be a accident, head injury, it could even be playing football. It could be in the military where they have this traumatic brain injury. So let's look at PTSD. So PTSD can be a short experience lasting only days or weeks, or lasting months or years after a brain injury. The symptoms are usually intrusive, and they're disturbing thoughts or images that come into your mind without warning and refuse to go away. So you've probably seen some war Vietnam veterans, and they can't be around fireworks because the sound of the fireworks causes them to have those disturbing, intrusive thoughts, and it brings them right back to like they think they're in the war again. Avoidance of thoughts and behaviors, negative changes in thoughts and mood, and then changes in arousal and reactivity. So we're reacting to this fireworks sound. Depression occurs in half of all people who experience a head injury, especially in the year after their injury. And it can result in either physical damage to the brain, or it could be just emotional response to the injury. And then anxiety, same thing. That occurs in about 30% of people who experience a head injury in that first year after the injury. And that also can be a result of the physical damage or just the emotional response to the injury. It's worth noting that anxiety, like depression, may not present early right after the injury, and so it might take a couple of months before it actually appears. So you might not think it's related to the injury, but it could take a couple of months later. Could happen a couple of months later. And then there's mood swings. That's the inability to regulate their emotions. So you think of a toddler, they can't regulate their emotions. That's why they're like, if you tell them no, they can't have that piece of candy in the grocery store, and then they just kind of fall out on the floor and start kicking their legs, they don't know how to regulate their emotions yet. And so, the inability to regulate their emotions can also occur because of the brain damage. And, because the part of the brain that controls behavior and emotional regulation is damaged. Symptoms of mood swings and lack of emotional regulation include people who are suddenly laughing out of the blue, so it doesn't seem like there's a reason for it, or suddenly crying out of the blue, or they have a sharp change from a happy mood to a sad mood or an angry mood. So, you could be talking to somebody and they're just like talking normal, and all of a sudden they just start laughing for no reason, or they'll just start crying, they'll switch over. So it's like a sharp change in their mood. And then it can lead to insomnia, so they can't sleep. That's common. 60% who have a brain injury have insomnia, mild short-term insomnia. Aggression is another symptom. It's about 11 to 34% of people with a traumatic brain injury exhibit aggressive behavior. I had a girlfriend who had a traumatic brain injury when she was in college, and she said, it didn't last, but she actually experienced aggression. And she said she was really embarrassed about it because she couldn't control it. And she was trying to, and her family thought she was just being difficult, but she really couldn't control it. And it's usually verbal aggression, like cursing at the person. And then the most common injury or symptom is trouble with thinking and problem solving. So, okay. Forgot to move my slide. So stress, now we're going to look at stress. So stress causes psychological and emotional distress. Chronic stress can increase your risk of anxiety and depression. So, the fight, flight, freeze response, like when you're being chased by a tiger and you kind of like, like that. And some people freeze, and they can't move. Not that you're being chased by a tiger, but if you encounter some kind of really high stressful situation, some people freeze and can't move. Some people fight, and those are people who usually have jobs like police officer, a firefighter, or even nurses. an emergency room nurse. And then fight or flight, people who run. You run away, which is a good thing to do, because that's what they teach you to do when you encounter an active shooter. So those are the different types of, responses to stress. And it's called polyvagal chart, and it's our body's response to stress. But if you have chronic stress and it's like all the time, constantly, your body actually can get overwhelmed and burned out, and it creates a lot of unpleasant physical and psychological symptoms. So if you're constantly bombarded with it, your body is going to be triggered to have a fight, flight, freeze response to just something that's not even super stressful. And so you could just be, walking around doing your own thing, and then all of a sudden you have a certain smell or a certain sound, and then it causes your body to remember. It's not you causing it, but it causes your body to remember, and then you have a panic attack. So if you ever known anybody who has those panic attacks and they say, I don't know where it came from, it just came from out of nowhere. Well, there was a trigger that reminded their body of that stressful event. So that's how that happens. And so when we look at adverse childhood experiences, social cultural factors are risk factors for mental disorders and adverse childhood experiences. It's called ACEs, and it includes abuse, neglect, household dysfunction, can negatively impact the child, and that can cause health problems for the rest of their lives. Adverse childhood experiences causes toxic stress, and this is different than other stressors, such as studying for a test or preparing for a presentation. Toxic stress creates a near constant activation of a stress response system, which hurts other body systems. So a person can actually develop not only mental health issues, but they can actually develop heart disease, diabetes, all these other health issues that are medical from if they have like a high ACE score. So you can actually take a test to see what your ACE score was, when you were a child. Usually they ask questions about physical abuse, sexual abuse, emotional abuse, physical neglect, emotional neglect, mental illness, violence toward a primary caregiver like your mom or your dad, witnessing it, substance use, or divorce. So depending on how you answer the questions is going to give you the ACE score. And people who score very high, that usually leads to, unhealthy medical conditions. But if a person has had a person in their life, that was supportive, like a teacher or a minister or somebody like that, or auntie, then that can help the person be successful because they have that support. Now, a person without support, they're probably going to end up, in a bad situation. But if somebody had that one person who made a difference, and that's why teachers make such a big, influence on children, that can really help a child become successful and get through, difficult times. So treatment barriers are common for people who with a mental health condition. Most people who need treatment don't access care. It can be up to 70%. So a lack of awareness is a barrier. They believe myths about mental illness, which prevents people from seeking treatment. So they might think, oh, I just have a character flaw, and I need to be stronger and have more faith and willpower. Well, that's a myth. That's like saying if you have more willpower, you won't be a diabetic, or you won't have high blood pressure. You can't will it away. You have to treat it. Another myth is there is limited access. Well, this is not a myth. This is a barrier. There is limited access to mental health professionals. In March of 2023, 160 million Americans lived in areas with mental health professional shortages. And so there are over 8,000 more mental health professionals needed in order for us to have an adequate supply. That's why virtual Providers are a thing now because you can actually see people. As long as you're licensed in that state, you can actually see people in a different state. So that makes access go out to a lot of people who don't have, honestly, who don't have the transportation, who don't have the money to drive. You know, it's expensive to drive somewhere, to have the time to go somewhere, and most people are depressed, and it's going to be hard for them to get up and go somewhere anyway. So virtual care is really important for people with mental health issues. And then, you know, people on Medicaid struggle to find providers because the insurance, you know, it's such a low reimbursement rate for Medicaid. You know, a lot of providers don't want to take clients with Medicaid. I mean, I think that's a horrible thing to not take clients, you know, just because of their insurance, because you can have you don't have to have all of your patients on Medicaid, but you need to be taking some people with Medicaid. You know, you need to be seeing some people, especially children, you know. Cultural barriers. So different understandings of illness or health and a lack of diversity in mental health workforce create mistrust and fear of treatment. So it's usually there's a thing called therapeutic relationships when you're taking care of people with mental health issues. And so therapeutic relationship, that is one of the main things that's going to be successful in treating a patient. If you don't have that trust between client and provider, then it's not going to work. You need somebody who's going to listen to you. You need somebody who is going to be flexible and have you be a part of their treatment plan, because if you just tell a person, I want you to do this and this, you know that person's not going to do it. You know, they're going to be like, forget it. They're just going to listen to the provider and leave the room. But if you have a therapeutic relationship with them, and a lot of times culture has a lot to do with it, but it doesn't necessarily need to, as long as the provider is culturally educated, then they can understand different things, you know, about their culture. They have these certain beliefs, and then if they don't, they can learn from the patient. So you have to have somebody who's open-minded. And then stigma. People fear being labeled and being discriminated against, and that's a thing. Because if you have a mental health issue, it's not always a good idea to let your employer know. You can let HR know, but I don't think I would share that with my direct supervisor. You know, I don't think you don't share that you have diabetes or high blood pressure or all this other stuff. So why would you share that you have a mental health disorder with your supervisor? You can tell HR. That's the only person who needs to know. And that way they can't fire you. You know, they'll try. I've had clients where their bosses fired them for some random reason, but the real reason was because they found out they were bipolar or something like that. So that's not cool. So, you know, learning to eliminate stigma is really important. And as I stated earlier, 1 in 5 children experience mental health disorders, partly because parents don't want to label their children and hope they'll just get think it's just typical behavior. But it's really important to get your kids checked out. Like I was speaking earlier before you guys came in, my grandson's autistic, and he was nonverbal, and he was like Helen Keller when he was like a baby till like 3 years old. He didn't speak any of that. He would throw tantrums, he would punch, you know, because he was frustrated. Now he's going to be turning 8 tomorrow. He's in school. He's above average IQ. They just did his IQ. He can read encyclopedias. He knows about all this, what is periodical chart, you know, of elements and everything. I mean, he makes up games about it, you know, math games, adding, subtracting, and all this. And so he's very kind. He's very polite. We take him on nature walks before he goes into class so he can get his mind, you know, calm his body. And so he can have a calm body and be ready for school. So he's like, you know, you have to understand that. But we got him, my daughter got him help when he was 3 and put him in a therapeutic preschool intensive every day, 5 days a week, all day. And it worked. So if you don't give up on people, treatment can actually work. So it's important to educate yourself and others and discuss things with people. Let them know there is help. You know, get people to listen to you. Share your stories. Treatment can be medications, psychotherapy, treatment programs, inpatient programs, and then even brain stimulation therapy. All of those things are really good. But one thing you got to remember to do is that lifestyle change. So when you have blood pressure, when you have diabetes, what's the first thing they tell you to do? Lifestyle change. So exercise is important. 30 minutes of walking every day. It boosts your mood, improves your sleep, and sleep is major for decreasing anxiety and depression, and it's good for your overall health. So 30 minutes of walking every day, at least. You can start off small, but build up to 150 minutes. And when you say exercise, I don't really like to use the word exercise. It's physical activity, so any kind of movement. So you want to just move. Just remember that when you walk, that's a cardio exercise, depending on, you want to get up to a pace where you're going to be working your heart muscle, because in order to get your muscle, you want your muscle to gain muscle mass in your arms, legs, and back, but you also want your heart to be a strong muscle. If you're not doing enough aerobics to work your heart so that it can be strong and maintain that strong heart, it's going to develop into some type of, heart failure, because your heart is not being exercised. So walking and exercising and breathing and all that stuff is really important. Always check with your doctor first, but that's really important to keep your heart muscle strong as well as your other muscles. Fueling a good mood is important by eating healthy foods. So you want to stay hydrated. You want to limit your sugars and processed foods, eat a lot of fruits and veggies, and consume those healthy fats. They tell you, remember they had a time where they said fat-free? Well, you want to eat healthy fats like avocados, nuts, olive oil. You can also eat dark chocolate, because dark chocolate is healthy. It helps to improve your mood. Not milk chocolate, though. But dark chocolate. A little bit of dark chocolate is good. Omega-3 fatty acids found in fish, oils, and nuts. That's good for depression. I keep forgetting to, to advance the slide. Okay, so let's look at this caffeine. Okay, so drinking too much caffeine can wreak havoc on you. And so it'll make you irritable. You have trouble falling asleep. You have trouble staying asleep. And so you really need to limit it. For healthy adults, you shouldn't be consuming more than 300 to 400 milligrams of caffeine a day. And so it can be sneaky. This caffeine can be in energy drinks, carbonated beverages, even medication. Tylenol, migraine has caffeine in it. Water pills, some of them have caffeine in it. So you got to be careful and really read labels. So this is about children. Children's brains are continuing to develop, and their bodies are still growing. So limiting caffeine is really recommended. And so they they actually say that caffeine interferes with their sleep, possibly hindering brain development. When your kid is not getting enough sleep, and that's why you need to make these kids go to bed on time. Because if they're not getting enough sleep, their brains can't develop, normally. And that's like when a person has issues like ADHD or autism or something like that, and they have sleep problems. You really need to try to figure out a way to get these kids to go to sleep. So if you need to give them a little melatonin, that's fine. If you need to give them a little magnesium, that's fine. Magnesium glycinate is a supplement that a lot of people, I'll have their PCP do their labs for their vitamin D and their magnesium levels. One young lady had very low vitamin D and magnesium, and she was having a lot of depression and anxiety. As soon as she started taking the supplements, it went away. So hers was medical. So you can have these vitamin deficiencies, so it's important to find out. All you have to do is ask your doctor, can you do a magnesium level and a vitamin D level on me? Blood test. They can say, okay. Can caffeine is not recommended for children under 12. Um, and if you do give them caffeine, um, 45 milligrams a day is considered safe. Oh, sorry. Yeah. So developing teens should not have more than 100 milligrams of caffeine a day. And teens have so much caffeine because they're all drinking those energy drinks, which is really, we can have it on their sleep, and then they're using they're on their TikTok at night in their bedroom, because I know nobody does Facebook anymore. And so all that blue light, so that takes us to, going backwards, sorry. That takes us to the next slide, which is why is sleep important. So 1 in 3 adults don't get enough sleep. You're supposed to get 9 hours of sleep. And sleep is really important because it regulates your production of melatonin, which regulates your mood, productivity, and your eating behavior. If you're not getting enough sleep, you're going to think you're hungry when you're not. You're going to be tired. You're not going to be able to be as productive. Sleep improves those neurotransmitters that help your brain to help you to focus, concentrate, and be more productive. It increases athletic performance. So I'll tell high school kids, that, especially the guys, and then that makes them go to bed on time. And for women, for the girls, I'll tell them it helps regulate your weight. So then they'll start going to bed on time. And, it helps you recover from illness. So that's why when you're sick, you go to bed, the body is telling you need to get some rest. And it'll help strengthen your immune system so that you can get well. Adults should aim for 7 to 9 hours, and children probably about 10 hours of sleep. What you can do is you should put away all electronic devices an hour before bedtime, because those electronics have that blue light. And so phones, TV, computer, if that light, when it gets dark, your brain tells your body, oh, it's time to go to bed. And so your brain secretes melatonin naturally. And then you get sleepy, and then you go to bed. If you have blue light coming at your eyes and going through your eyelids and hitting your retina, that's telling your brain it's not time to go to bed. And that's making it secrete orexin, which wakes you up in the morning when the sunlight comes out. So that's telling you to wake up. And so that's why you can't sleep at night. You got all these electronics and blue light in your room. So that's why you need to, and orexin is a stimulating hormone, so you don't want that to happen when you're trying to sleep. So that's why it's important to put away electronics an hour before bedtime and block out excessive light and sound that keep your room cool, because you sleep better when the room is cool. And then when you can't sleep, just get up, reset, and relax, and then go back to bed. So that's how you get rid of insomnia naturally. Sleep deprivation, it wreaks havoc on you. It could lead to weight gain, like you said earlier, diabetes, high blood pressure, coronary artery disease, stroke, and even mental illness, which can include paranoia and hallucinations. So adequate sleep can help prevent these issues. And then dealing with insomnia, the following factors can disrupt sleep quality. So if you're stressed or you have anxiety, so treating that is important. If you're in pain, some people have chronic pain and they don't even realize, they don't even feel their pain anymore until somebody brings it up. But if you have an annoying, sometimes people don't call it pain, they say it's just annoying discomfort, but that's pain. That can keep you awake. Heartburn and asthma, some medications like stimulants or medications with caffeine in it, actual caffeine drinks, alcohol and other drugs when you drink alcohol, it'll make you fall asleep hard initially, but then you'll wake up and then you'll be up. So that's not a good idea. Sleep apnea can, cause poor sleep quality and then sinusitis. So it's just good to have a bedtime routine. Go to bed on time every day, every night. And then, like I said, make your room dark, quiet, and cool. Remove those electronics. And avoid those large meals. You before bedtime. Large meals, large caffeine and alcohol before bedtime. You want to avoid that. And then exercise in the morning, because if you exercise at night, it's going to wake you up. You know, if you do exercise in the evening, try to exercise and give your body enough time to relax, because that's like stimulating your body. So that can be, you know, a stimulant. You don't want that to happen. And then last but not least, self-care. So all self-care is taking time to do things that help you to live well and improve your physical and mental health. And so in order to manage stress, you want to manage your stress to lower your risk of illness, whether it's mental or physical, and it can increase your energy. And there's just small things you can do for self-care. So try relaxing. Before relaxation or wellness programs, you know, explore them. Like Calm. Calm is an app you can do. Like if you want to walk, you don't have to run. You don't have to. I mean, it's good to get your heart rate up so you can exercise your heart, but sometimes you can just take a nice, calm, relaxing walk and listen to Calm or something soothing, you know, and that will relax you and it decrease the cortisol in your body, and it actually helps you lose weight just because you're relaxing and you're not creating that cortisol effect. Because if you exercise too hard, you're going to release cortisol and then you're not going to be able to lose weight. You probably know some people who say, I run every day for 5 miles or 10 miles, but they're not losing any weight. So that's why, because they're overdoing it. Schedule self-care. Make sure you schedule it in your day and set goals and decide what needs to get done and what can wait. Learn to say no. You know, if you feel like you're doing too much and your family is just overextending and asking you to do this and do that, just say, I'm sorry. Just say, I don't even say I'm sorry anymore. I just say, unfortunately, I'm not able to do that. And they just kind of look at me like, wait, what? What did you just say? But I've learned how to be very tactful without them instead of saying, oh yeah, I don't know. I think I might have to do this and I have to do that. So I don't know if I'm going to have time. They don't care. They're going to still expect you to do it. So you have to learn how to say no. And then practice gratitude. So write down things that you're grateful for. Write it down. Think about it at night, like before you go to sleep. Think about it and then write it down. And then when you wake up in the morning, you can read it. And it's a really positive thing to do. And then stay connected with your friends and family. Focus on positivity. Change your negative automatic thoughts. And I had to learn this. And they're called ants. And you automatic negative thoughts. And so I used to, and women tend to do this. Whenever they do something or they make a mistake, and then you do this negative self-talk. Oh my God, you're so stupid. Why did you do that? Oh my God, I can't believe you. You know, it's a natural thing that we do. I don't know why. And then I was like, wait a minute. You are not, what are you doing? So then whenever I would start that, I would just tell myself, actually say, stop it, stop it, stop it. And then I'd say, you are perfect. You are a child of God. You do good things and you are good. And then, anything, any kind of positive affirmation. And then I would just breathe and I would feel good about myself, because you're giving yourself self-care like you would talk to your child, like you would talk to a child. So you have to be your own parent to yourself. And then there's also these self-care books, but you can just do that. You don't have to spend money on a self-care book. So mental health is just as important as physical health. And your brain is one of the organs in your body, and you want to keep it healthy. And to keep your brain and mind healthy, you need to see a mental health professional if you start experiencing mental health symptoms that last more than 2 weeks, or if they are seriously interfering with your ability to function at work, with your family, or your social life. So don't be afraid to reach out to someone who needs help. Or if you need help, don't be afraid to reach out. And you can contact NAMI Helpline to find out what services and supports are available in your community by calling this 1-800-950-NAMI. Or you can text help to 62640. If somebody is struggling with if not if they're not suicidal but they're struggling, they can text or call 988. They can text 988 or they can chat on 988lifeline.org, which is online. That's a National Suicide Prevention Lifeline for support and assistance, and they have trained counselors. But if you're in immediate danger, you need to call 911. If somebody is saying they're trying to kill themselves, then you just need to call. Don't try to be a hero or a doctor. Call 911 and let the professionals handle that. Any questions? It's, look, I have to look it up. Hold on. The National Alliance. Yeah, it's right here. Wait a minute, where is it? National Alliance of Mental Illness. Yeah. Yeah, it's it's a lot of resources out there. That's a good resource. National Alliance of Mental Illness. Yeah. 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 See, there's an increase with seniors and children, because they were the ones who were more isolated, because the seniors had to stay put, but then that was kind of scary because they were staying put, but people were still coming in and out of the facility and making them sick. And then children couldn't, these kids are behind, because they didn't get the socialization skills. They didn't learn those social skills that they needed to. So now they're behind socially and academically. And that's affecting people, and especially the ones were graduating, graduation age, they weren't ready for college. It's just a lot of stuff going on. I see a lot of, actually, I do see a lot of seniors. I say seniors, but they're my age. But I see a lot of people my age who are struggling, a lot of women who are struggling my age because they're trying to find their voice. They're so used to being everything and for everyone. And now they feel guilty, for just making decisions for themselves. And then people who are like in senior communities, they still have fear. You can see them, even if they're not in a senior community and they're walking around, a lot of them will not take their mask off. They have so much fear, so it's affecting them. So they stay away from people. They're not going to church anymore. They're not going to the recreation senior rec centers, it's doing the exercise, it's a lot of that. My mom won't even go. She's staying at home, and I'm trying to get her out. I gave her a really good mask to wear, and she still doesn't want to go anywhere. So I think, yeah, exactly. And yeah, and then they lost a lot of their friends. So that part, we lost a lot of our friends. What am I saying? I lost a lot of people. Whew. Yeah. I'm sorry, I didn't hear you. Oh yeah, yeah, I did. Yeah, it was so scary when I was I was a new family nurse practitioner working in a school-based health center, but since the schools were shut closed and shut down, I got deployed to the hospital, and I was at the St. John Ross. Oh my God. Because they didn't let people in, but I had to walk around the floors, and I didn't have to take care of a patient. My job was to keep the staff safe. So I had to teach them, I had to monitor them and teach them how to, take things off and put their protective gear on so that they wouldn't, you know, contract COVID. This was before the vaccine. So it was so, and my coworkers, they had never done a OR before, so they didn't know what they were doing. And so I just told them, you stay over there and I'll take care of all the ICUs, because they were touching everything and touching their face. And I'm like, oh my God, they're going to contaminate everybody, because then they're going to get sick and they're going to make everybody in the cafeteria sick. So I made them stay away from the ICUs, and I did all the floors, all the ICUs. And when I tell you, those were heroes that worked there. Those nurses, man, oh man. Yeah, I mean, I would just, whenever I'd see some, like one young guy, he was an agency nurse, and there was a cold, and he was running into the room. He's a big guy, and his gown was just barely fitting, and it was just covering the front of him. Well, he was like all exposed, and he didn't even put on a mask. And I was like, oh my God, what is he doing? It was too late, you know. So when he came, I went and told the manager, and I said, you need to get him. I said, he went in that room and he's unprotected. So now he's unprotected, and so now he's gonna making everybody else exposed to it, because he went in there. And she's like, well, we don't have his size. I said, well, then he doesn't need to be working in this on this floor until you get a gown that fits him, a mask that fits him. So then they took care of it and they got everything. But that was the most horrible thing I'd ever seen in my life. And then everybody was gray on the vent, you know. And then you see just too much information, but then you see, like, you standing in the elevator, by the elevator looking down, and you can see in the part that's petitioned off, you can see the refrigeration trucks, 1, 2, 3, 4, and you can see them pushing the bodies out on these slabs and filling up the trucks because the morgue was full. That was horrible. Yeah, yeah. But by the grace of God, my doctor told me how to protect myself, you know, and so I did exactly what she told me to do. But yeah, oh no, especially in New York, that was horrible. That was horrifying. Yeah, I don't know how much you saw, but yeah, you're right. That's what you did. They just mass graves, and a lot of people don't even realize that's what happened. Okay, take care. Bye bye.